It's time to stop blaming our heel for our heel pain. What's up everybody? Tim Rementor, Doctor of Physical Therapy, Orthopedic Specialist, and this is Plantar Fascia Fixes. Unless you like the idea of people getting unnecessary surgeries, make sure you subscribe to the channel. I've watched hundreds of videos on YouTube about plantar fascia fixes, and almost all of them, with the exception of maybe Athlete X, are just talking about band-aids for the situation. So often in clinical practice, I see patients with a medical history that includes years of heel pain. It's very common that these patients had attempted to address heel pain with multiple, if not all, of the following standard treatments, including medication, ice, stretching, boots and casts, orthotics, ultrasound, shockwave therapy, injections, sometimes even surgery or reconstructive surgery. The worst part is, so many of these patients are still in pain. Many of them have not even had physical therapy. After evaluation, I find movement-related problems in multiple areas. What I want you to understand is that there are many things that feed into your heel pain and plantar fasciitis. It's not just your heel. This video is the first to launch of a 4-part series. Please remember, any pain you're having is reason to reach out to your movement specialist for evaluation. These issues are complex and don't permanently resolve with a quick fix. My hope is that watching my video will encourage you or a loved one to reach out to your movement specialist for further evaluation and a permanent fix. Physical therapists are uniquely trained in the science of human movement and can help you get to the underlying cause of the problem. Part 1. The hip. It's the center of the body and home to the strongest muscle in our body, the gluteals. If this area is not moving correctly, the areas above and below are impacted. Keep watching as I review hip stretching and strengthening and movements that can be helpful for your hip mobility. The most important part of your hip when it comes to foot and ankle pain is the ability of your hip joint to extend backward. When we take a stride, this hip needs to move in that direction. If it can't move in that direction, the motion has to come from somewhere, so the ankle is going to be asked to move more, or your stride will shorten, which will lead to weakness and more problems down the road. Typically, people will rotate out to gain the motion, which results in bunions, and you guessed it, plantar fasciitis. So hip extension is so critical for every foot and ankle pain problem we're seeing. So let's take a look at a stretch for our hip that's going to work on extension and also sideways motion and rotation. We're going to use a chair to do our hip flexor stretching so we have something to hold on to for balance. We want to keep our foot straight. You want to keep your stomach tight, squeeze your butt muscle, and just drive this hip bone forward, keeping your upper body still. You should start to feel a stretch in the front. If you feel it in your back, you need to stop and restart. And if you're feeling it in your calf, your foot's back too far, and it's just stretching your calf and not your hip. Once you're being stretched, then you want to add rotations of the pelvis and side-to-side movements so that we're stretching out the hip just like it does when it walks. And we switch legs and go through the same sequence. Start off with 10 seconds and work your way up to 30. When we're working our hips, we want to take it through that full range of motion just like it does in walking. So it rotates, it bends a little bit to the side, and then moves forward and back. Your pelvis kind of rotates over a planted foot. So you're just going to essentially stand on one leg and try to bring, squeezing this butt muscle, try to bring this hip up and around like you're bringing it over a fence. Just picture yourself bringing that over and down and then back through. This is the exact same motion that's happening when you're running or when you're walking. You should feel it on this side. If you're feeling it anywhere else on your obliques over here, you're not doing it correctly. You're going to feel some ankle and calf burn as well, just from balancing yourself. I'm consciously thinking about squeezing these hip muscles, kind of tightening my butt on the right side. Again, if we have concerns about balance, just fingertips on a chair. This will help with a lot of leg problems, knee issues, foot, ankle, toes, bunions, all can benefit. For the functional strengthening part of our program, we want to get our glutes to be driving back into hip extension rather than relying on the calves and the foot muscles, which are putting too much stress on the plantar fascia. So all we're going to do for the activity is just step forward like we do, but activate the glute and drive it back. I'm squeezing to force me backward, trying to use my calf and foot as little as possible. I'm just contracting and driving. Contracting and driving. And you're just going to go through high repetitions, probably 15 or 20 on each leg. You switch, drive, forward. By now you should realize there's more going on with your heel pain than just your heel. Remember that next time you go to stretch your calves and the pain doesn't go away, there's a movement specialist in waiting to help you. For this and more content, subscribe to the channel and turn on notifications. Remember, if you want to feel, perform, and live your best, you've got to move your best. Keep it moving.